want to hit this national health care stuff that's going to be brought up by Milhouse tonight in his speech. And there's nobody better than Sally Pipes, President and CEO of the Pacific Research Center. How are you, Sally?
I'm well, Mark, and you?
Very well. I'm sorry to pull you out of your meeting.
No, that's okay. It was probably time to end it anyway.
Okay, good. You're always so polite, as a matter of fact, as I recall. Here's what
it's
a
Canadian thing.
It's a Canadian thing. Well, speaking of Canadian things, so is national health care, right?
Right.
So they say, this health care is very expensive, and they put out a report today just perfectly timed for Obama's speech and to push this national health care stuff. This is a huge issue, but we really do need to get it focused. Why is national health care such a hoax?
Well, Mark, there are two competing visions that are out there right now for healthcare reform. One which focuses on taking us down the path to more market-based healthcare, empowering doctors and patients, encouraging innovation through new drugs, biologics, and medical devices. And that's the vision that I like and I think will lead to reduced costs and lead to universal coverage. But the other vision that is out there, and the one that Obama and Emmanuel and Tom Daschle had been promoting, was one focusing on increasing the size of government through mandates, subsidies, and taxes, and taking us down the road to, as Teddy Kennedy says, Medicare for all, a single-payer government healthcare program, which is the Canadian healthcare system, where yes, they spend 10% of gross domestic product on healthcare in Canada. We spend about 16% of healthcare on our healthcare, and everyone says, well, it's just too much, and we need to get that number down. Well, the issue is maybe 16% isn't enough. Americans want the very finest in healthcare, but if you introduce a Canadian-style system where the government will only spend 10% of gross domestic product on healthcare, you get long waiting lists for care. The average Canadian today waits 17.3 weeks. That's over 4 months from seeing a primary care doctor to getting treatment by a specialist. Care is rationed. And that's exactly what I wrote in the Wall Street Journal at the end of December, that Obama's going to ration your care by trying to reduce costs, by setting global budgets, by mandating care, setting up a national insurance exchange within which would be a national insurance company which would compete against the private sector. There would be several mandates, guaranteed issue, community rating, and the government plan would be offered at a cheaper price and would crowd out private insurance, and I think move us down the line to a single-payer Medicare for all system, and the American people are not going to like it. They don't like standing in line at the post office, as you know, Mark. They don't like standing in line at the DMV. When the government takes over their health care, they'll be standing in line waiting for care.
So there are not 47 million people without health insurance
or health care
who are lying in the gutters because they can't get help or don't. You're breaking it down, and you're saying many of these people can afford it and choose not to. Many of these people can apply for programs that exist and do not. Many of these people are young people who don't want it, and in fact, many millions are illegal immigrants on top of that.
Right. It's Pete Stark, the representative from here in California. He was responsible for the EMTALA law many years ago, which says that an emergency room, a community hospital, a community clinic cannot turn anyone away. So people in Canada, where I'm from, think, oh my gosh, 46 million Americans don't have health insurance and don't get health care. They're born one day, they die 79.5 years later, and they've never had any type of health care. And that's more people, 46 million, than the total population of Canada at 33 million. So you have to break it down and say, we can get universal coverage in this country if we have universal access, if we have a universal choice in health care. And mandating employers, mandating individuals. It doesn't work in car insurance. It hasn't worked in Massachusetts, where they Romney Care experiment. Mm-hmm. Still, 5% of the people are still without health insurance. The individual mandate did not work. People did not sign up for Commonwealth Choice. The majority of people signed up for the free or the subsidized Commonwealth Care, mm-hmm. and it's putting a tremendous pressure on the budget of Massachusetts.
Right. Sally Pipes, I'm also amazed at the fact that we already have massive government-run health care, and how's that doing?
Well, in this country today, and people in Canada don't realize this, and I think a lot of people in America don't. They think we have a private health care system. Mark, 47% of health care in this country is in the hands of government, whether it's through Medicare, the program for the elderly, Medicaid, the program for low-income people, the state children's health insurance plan, which has just been expanded, and the VA system. Politicians like Obama and Mr. Baucus, these are people, Tom Daschle, they're politicians that want to take away that other 53% and put the total American population into government-run health care. They say it will be cheaper. If you cannot get access to health care, it is not cheaper. In Canada, the Canadian Supreme Court, not known, you're a lawyer, not known to be a conservative court, when they made a decision about the province of Quebec, Madam Chief Justice Beverly McLaughlin said that the idea of not allowing private health care or private insurance is illegal because Quebecers are entitled to life, liberty, and the security of the person. These long waiting lists do not give people security of the person. And she said, access to a waiting list is not access to health care. If we let the government in this country take over our health care, and it's a very frightening and could happen, unless people like me and you and Rush Limbaugh and all these people, the other people in the think tank movement, get out and educate Americans, we're going to go down that path. And the American people are not people who like to be told, you have to wait 4.5 months for an MRI. And, Canadians come to the United States and pay out of pocket for an MRI when they think they might have a brain tumor. They go home, they find they have to wait another 4.5 months to get an appointment with a neurosurgeon. They come back to America, pay for the surgery, go back home, and then they sue their provincial government because the wait was so long. Politicians in Canada, Belinda Stronach, when she was top politician, when she was diagnosed with breast cancer, all of her speeches in Parliament in Canada were, we cannot have a two-tier healthcare system. We can't have private run parallel with the public. But when she was diagnosed with breast cancer, on the advice of her doctor, she immediately flew down to UCLA and had her surgery done there and paid for it out of pocket. It was fine for her to have a choice, but not for the rest of Canadians.
All right, let me ask you.
All of the research and development done by the pharmaceutical companies and the new biotech companies is done in America. It used to be done, you had the AstraZenecas, the GlaxoSmithKlines, the Roches. These were international companies, but they stopped doing research and development in Germany and France and in England because of price controls on pharmaceuticals. You can't stay in business in any business unless you can make a return on your investment. So they do the R&D in this country, and we are paying for that research and development. These companies can sell drugs into the other markets at a lower price once we have paid for them. So these people in other countries are free riding off our research and development that we're paying for. But you also have to know when you have price controls, a government like in Canada, the Patented Medicines Prices Review Board, which reviews all new drugs, many new drugs that we have access to here in America are not, they're considered still too expensive in Canada, even though they're price controlled, and so they don't make it onto the formulary. So Canadians don't have access. My uncle, who passed away a few years ago from non-Hodgkin's lymphoma, when I told my cousin, who's a doctor, that Rituxan was the new drug for NHL. Well, it was interesting. When he went to the head of the Cancer Control Agency, he'd never heard of Rituxan. But he said, well, you can take your father to the States, to Seattle, and have it. A lot of these drugs just aren't available because they're still considered too expensive here. But if we destroy the pharmaceutical industry in this country, if we introduce price controls, as some of the Democratic politicians now want to do under Medicare Part D, the prescription drug program for seniors, we're going to destroy that innovation and research, and it's going to have an impact, a negative impact on all of us and the ability to live longer and healthier lives for you. If you read Henry Morgenthau in 1939, after all of the FDR and all of the big government money, unemployment had gone up. 7 years later, it had not gone down. And with the stimulus package and all that we're doing, we are not going to solve the problem. We need to put the market back in charge.
Well, this is
and I'd like to say, I'd love for people to get my book, The Top 10 Myths of American Healthcare, A Citizen's Guide, available on Amazon.com.
We are going to link to your book. And as a matter of fact, I linked to it about 6 weeks ago. You should have gotten a little pop out of that.
I did, yeah, and Tom Sowell's fabulous review, which you promoted. So thank you.
Well, it's a great book, The Top 10 Myths of American Healthcare. Folks, you really do need to be armed with this because one of your drone neighbors says, Well, why are we spending so much? Well, there's a lot of reasons for it, and Sally Pipes has the answer. She's the president and CEO